Natarajan Ranganathan. People normally call me as Dr. Rangan or Dr. Ranganathan, more as Dr. Rangan, and I am the founder and the managing director for research and development of a 20-year-old company called Kibo Biotech at Newtown Square. We are a small biotech company, basically heavy on research and development. There are about 17.2% of prevalence of chronic kidney disease patients in India, and almost 1 lakh or 100,000 patients enter into dialysis. More than that, kidney disease is not a primary disease, it is a secondary disease. 1/2 of the diabetic patients end up with kidney problems. 1/3 from hypertension or cardiovascular disease, and the remaining is HIV, lupus, tuberculosis. India is known as the capital of diabetic disease. So you will have much more patients affected by chronic kidney disease in India than any part of the world. To my knowledge, there is not much advances. They still undergo the dialysis and probably maintain controlled diet. Other than that, at the present time, there is no treatment per se for chronic kidney disease other than controlling their primary disease. Basically, any country, if you can avoid the need for dialysis or postpone the need for dialysis, that could be an immense help in saving the healthcare cost. And dialysis, as you know, is a very painful process. It is 3 times 4 hours per session. And in USA, dialysis is covered only for about 6 months or so by the insurance company. But later, the dialysis is covered by the US government. Renadol is a product which we have developed over 20 years of expertise. Normally, the composition of this product is probiotics. Now you know probiotics is the rapidly emerging field. And Renadol contains 3 distinct strains of probiotics. It utilizes the uremic toxins. To give you a sort of an idea, basically when you eat your food, after digestion, the food is absorbed from the small as well as a lot of it from the large bowel. The reverse happens when the kidney fails. The kidney is not able to eliminate the toxins. So the toxin diffuse from the circulating blood into the bowel. The bowel was not recognized as an organ until 2004. Everybody knows about liver, kidney, breast, brain, etc. Now only we are learning more and more about what is called as gut microbiome. If you take your whole body and count the number of cells, you have 10 trillion cells. 10 trillion, I'm using the word, with 23,000 genes. Whereas if you take about the 2 kilograms of the material that you have in your bowel, count the number of cells, it is 100 trillion cells. The number of genes present is 3.3 million genes. You will have to ask, who is hosting whom? Basically, we are now learning with the advances that is happening in an exponential way that every disease is associated with the imbalance of the microbiome or gut microbiome, what we call as this good microbes versus the bad microbes. When this is disturbed, it's called as dysbiosis, it's the imbalance, I should say. So chronic kidney disease is recently discovered is as a result of dysbiosis. Now we are learning, not necessarily chronic kidney disease, every disease is associated with the imbalance of the gut microbiome. Probiotics can never be sold as a drug because there is no company in the world making probiotics with the drug master file. It is either a food grade or a dietary supplement grade. So in USA, this is not a drug. This is a dietary supplement or health supplement. Very similar to fish oil. We distinctly know now fish oil helps you to protect cardiac health. Fish oil has taken 40 years to be recognized that it has a positive benefit for heart. In our case, we have taken 20 years. We plan to be doing a multi-site, large-scale clinical trials to document we are able to arrest the decline of the kidney function and help to maintain and thus delay or postpone the need for dialysis. It depends upon person to person. We have been trying for a long time. It is so fortunate that all of a sudden things developed in the past 6 months that we came across a company called as Centaur Pharmaceuticals, which is a family-owned company, a privately held company. By the way, Kibo Biotech is also a small family-owned company, extremely strong in research and development. So we are delighted that we have a collaboration that we are establishing with Centaur, and initially they will be importing the product from USA, and ultimately we will also give them the entire technical know-how so that the product can be manufactured in India and provided them, in a sense, market and sell them at a very reasonable expenses or cost that the Indian people will be benefited. So in that aspect, I really applaud Mr. Sawant, I should say, who just joined me in not only collaborating with that, with the ambition that we want to be part of a solution to the society who are badly in need of product for chronic kidney disease.